All right. Hello, everybody. Good afternoon, and welcome to the Elmhurst Seventh-day Adventist Church and to today's lecture on biological dentistry with Dr. Mandeep Raina. Just a bit of basic announcements. If you are new here, we're so happy that you're here. And just so that you know, the restrooms are out the hallway. Once you walk out of the doors to your right-hand side, there's also a drinking fountain. And after the lecture today, we will also have refreshments, so please do stay and join us even when we're done. We're never done here. We always love to have fellowship with everyone. Let's see, is there anything else I'm forgetting here? Okay. For those of you watching online, welcome also. You will be able to ask questions online as well as the people who are here when our speaker is finished with her presentation. So please do send us your questions. And without further ado, I will introduce our speaker, who is a personal friend of mine. At least I hope so. I'm just kidding. We met in the funniest way. And she's also the dentist of my children who are here, happy, with all of their teeth intact. So Dr. Mandeep Raina is a holistic and biologic dentist practicing in Bolingbrook, Illinois. Born and raised in India, she earned her dental degree from New York University, followed by a residency in general dentistry at Loyola University, Chicago. Dr. Raina is a member of the International Academy of Oral Medicine and Toxicology, American Dental Association, Holistic Dental Association, and Chicago Dental Society. After serving her community with compassionate dental care for more than 15 years, Dr. Mandeep Raina firmly believes that there is a place for empathy in professional dentistry. She spends her professional time evaluating, diagnosing, and treating the physical condition of her patients by utilizing various holistic and biologic methods, but she also takes the time to understand their fears and anxieties as it relates to dentistry and healthcare in general. She strives to create a more harmonious experience for every patient and continues to enhance it through advanced education and training. In addition to enjoying biologic dentistry, she mentors children and teenagers through the Empower the Youth program at the Science of Spirituality Center in Lisle on holistic wellness, meditation, and the importance of a plant-based diet. When she is not teaching her patients in the community about preventative dental care, you'll find her enjoying soccer, hiking, and enjoying Bollywood movie songs. She also enjoys traveling, but is just as content relaxing with a good book or practicing meditation. So without further ado, I will bring up Dr. Mandeep Raina and just have a short word of prayer. Dear Heavenly Father, thank you so much for this day and for the ability to have all of these wonderful holistic speakers to teach us about our body and our mind and our spirit. And thank you for Dr. Raina. Please speak to her, speak through her, and help us to learn from her and to enjoy this time together. We thank you again and ask you in the name of your Son, Jesus Christ. Amen.
Amen.
Dr. Raina.
Thank you. Good afternoon, everyone. Thank you for having me here. It's an absolute joy, and as the saying goes, love has only a beginning, and we come here with a lot of love, joy, and gratitude. I always like to start my day by thanking God, my spiritual mentor, my parents. It's their love, support, and grace through all my growing years that enables me to stand before you with all humility and gratitude to share this knowledge through my personal experience and the resources that I have acquired from my education. I would also like to give a shout out to Bhavya. She is our office staff member. As you know, we cannot do what we do on a daily basis without our colleagues and our staff members. So I'm Deeply thankful to be here with you all and to share this beautiful journey of holistic biologic dentistry. It's a very fun journey as we say the word biologic. Biologic means meeting ourselves. So we're going to say hello to our true selves. So it has to be very fun, exhilarating, because we are going to discover how dentistry has revolutionized in a much better and healthier manner. So let's begin this journey. Every exit is an entrance to somewhere else. Now, we are bidding goodbye to the world of conventional dentistry and entering this new era of oral health, which we also call biologic dentistry, biocompatible dentistry, and we will see why we think that dentistry should be renamed as biologic and biologically compatible. But before that, with all due respect to conventional dentistry, that's where my education was, we must understand the fundamental difference between biologic dentistry and conventional dentistry. So biologic dentistry aims at the whole body. We would like to approach teeth with a whole body approach. As you know, a beautiful mind is a beautiful body and a beautiful smile. So the objective is to bridge this gap. But for that, we have to understand what are the factors which interfere in bridging these gaps. So the topics we are going to cover today, number one, toxicity. Where does toxicity come from? The various aspects that lead to toxicity in the body. Second, we are going to talk about what are the factors which help remove these toxicity. And third, we will talk about is prevention. So as we can see, biologic dentistry means a whole body approach to oral health. So how do we approach oral health from a biological standpoint? What are some of the toxins? We can start with root canals. Now, root canals generally mean dead teeth. So if we have something dead, it basically stops the transfer of communication between the immune system and the tooth. As a result of which, the tooth becomes more prone to infection, creating more toxicity in the body, and then we will also see some cases where it will lead to more health issues, and that's quite significantly alarming. Second, no fluoride, as I'm sure you all have heard. Fluoride is a neurotoxin, and we will see in further slides how it impacts our health in a very significant manner from a toxicity standpoint. Mercury. Now, we've heard a lot about amalgam fillings. Mercury, we know it's a heavy metal. What does it do to our body? We will learn something as we go in the further slides. Focus of biologic dentistry is always on prevention. We all have heard prevention is better than cure. To be in a preventative state is always being in a healthier state, and that's what we would like to do. So how do we focus on prevention? Through diet, lifestyle, nutrition, and something we will discover further down. Patient education and empowerment. I think this is my absolute favorite aspect of biologic dentistry. As Angela read, I'm also a mentor for children, and I teach them about holistic wellness, meditation, vegetarianism, or diet-based, focused, and that pictured together helps them stay in a more preventative stage in life, which enhances their health even further to understand the concept of medicine more clearly. So let's go on to now understand tooth-organ relationships. So this is a chart we show to our patients. It's a very simplistic, easier manner for patients to understand what biologic dentistry is. Now, some of the important science-based evidence research shows that 60 to 80% of diseases manifest in the mouth. What we see in the mouth is just symptoms. We must know that. So where do they come from? So I'm going to show you a few slides. It might get a little daunting. It's a little clinical, but it will give you a great understanding as you're in a dental office and the dentist pulls up the x-rays, and you can have that very open heart-to-heart conversation, because it's very important that today, with so much advancement in technology, a patient should be able to understand what is being shown, what is being discussed. So let's look at this first case here. A patient showed up. He had a tooth extracted some years ago, and the patient started having symptoms. He had an abscess, but more than that, he was undergoing some medical conditions like poor digestion. his pH was low, low thyroid, and right shoulder pain. He was lucky enough to be under the care of a naturopathic doctor, and the first thing the naturopathic doctor said is, please go see a dentist. Let's rule out if there is any dental infections. When he came to the dentist, there was a piece of root that was stuck in the socket. Once that tooth was taken out in a holistic manner using ozone therapy and many other biocompatible ways, the symptoms of the patient started improving. This is a very important case. A patient had a root canal, and the tooth was abscessed. That piece of metal that you see is actually a broken file. One of the complications of root canal therapy is that the files that are used sometimes can break depending upon how tight and constricted the canals are. The patient had no idea. Over a period of time, the patient developed multiple sclerosis, breast cancer, insomnia, and depression. She was again sent to a naturopathic doctor, and upon scans and diagnostic x-rays, this was found. The tooth was extracted. It was a long journey to recovery for the patient, but she definitely was recovering much better and was quite grateful that she approached her medical condition from a naturopathic way. Titanium implants. The one thing as a biologic dentist I would like you all to remember, no metal and nothing dead in our head. Okay, please remember that. As I said, immune system cannot transfer messages between dead teeth and the system. And with metal, the concept of galvanism, which is a very big contributing factor to leaky gut. So nutrients don't get absorbed, as a result of which patients develop other health issues. And this is something a naturopathic doctor like Ray, he is my doctor, and he can go much into detail about that. Now, here's a patient with a titanium implant. If you see, he came with symptoms of burning tongue, depression, low thyroid, poor gut function, and chronic fatigue. Once the implant was discovered and taken out, and with the help of a naturopathic doctor, this patient went through a process of detoxification and completely recovered from all these systemic symptoms. Some of the other causes of toxicity in the body, as we talked, fluoride. Now, one thing to remember, fluoride is not FDA approved. Many dentists prescribe fluoride in the form of supplements. It is not a supplement, okay, which is why it's not available over the counter. And it is not FDA approved. It is a neurotoxin. As we see, especially in children, excessive use of fluoride. Now, if you go to a dentist, they generally advocate, oh, you have to do a fluoride treatment, you have to do a fluoride treatment. And something that we see in our practice is a lot of kids who come presenting with fluorosis. And if you see that on these front teeth of children, please know that is where it is coming from. Some other health issues caused by fluoride toxicity, which is most important, I think, bone fragility, bone cancer, and low thyroid function. So, you know, this is the building block of our body, and I think we cannot tamper with that part of our health. Mercury toxicity. This has been a talk of the town, actually, for many years, where commercial dentists are really fighting back to prove this theory wrong. But there's more than 2,000 papers that have been published, and I will guide you to where you can read about it, that mercury being one of the heaviest metal and the most difficult to actually take out from the body. There's a process. And again, Ray is an expert in that, which has to be followed step by step in a proper protocol. Now, as we can see, an estimate of 80% of mercury vapor from dental amalgam is absorbed by the lungs and then passed on to rest of the body. Kidney is, in fact, one of the most susceptible organ to mercury vapors. Now, we should know how these mercury vapors are released. They are released during chewing a gum, or hot liquids. So if you have mercury amalgam fillings, please see a biologic dentist. And the most important aspect is how they are taken out. So we follow a protocol, it's called the SMART protocol, Safe Mercury Amalgam Removal Technique, so that it is safe for the patients as well as for the dentist, because the most dangerous time of amalgam fillings is when they are put in and when they are taken out. That is the time when vapors are released. So it's for your safety and the dentist safety. Please make sure the dentist is SMART certified, and that is the doctor to go to take out these mercury amalgams. We can see some of the symptoms. These are just some of them: fatigue, headaches, insomnia, psychological problems, kidney problems, cardiovascular, and tremors. So, some other causes of stress or toxicity, just besides things that you see in the mouth, are processed foods, soda, sugar, medication, negative thinking. All of this leads to a low pH. So it is all about pH, pH, and pH. Every time the pH drops, it's nothing but disease. So, what is the threefold mission of biologic dentist? Our threefold mission is to eradicate infection from the mouth. We saw earlier the titanium implant, a failed root canal tooth, and abscess tooth. Second, to remove toxic materials. Again, we avoid fluoride, taking out mercury fillings, metal implants. And third, function. This is where we have to work very closely with naturopathic doctors. It is very important for me to mention that as biologic dentists, our job is only 50%. We cannot achieve the full potential of what we want for our patient without the help of a naturopathic doctor. So they have to help us in the process of detoxification, in the process of healing, and in the process of maintenance, so that patients are always in a state of prevention. So biocompatibility, as you can see, there's a little donut sitting there, and it's really asking for a filling which is compatible with the donut. A chocolate goes really well with the donut. Similarly, what is biocompatible with us? Now, when we are talking about biologic dentistry, it is very important that the first step of biologic dentistry is to know. If you come to my office and you're like, okay, doc, so how do I know what is biologically compatible with me? What are you going to put in my mouth? So the first step is biocompatibility testing. We have two types. One is biocomp testing and a Clifford testing. There are about 1,700 dental materials that can be utilized, depending on the doctor, the dentist. Now, it is a very good step to do a biocomp testing. That way you know exactly what you're compatible with. Those are the materials you use, and you know there is no toxicity introduced into the body. Okay, rest assured. So it is very important to start with biocompatibility testing. This is the most important aspect of biologic dentistry: nutrition and supplements. Now, how does nutrition play a role in causing cavities? Now, if you look at a tooth itself is not solid. There are 3 layers of a tooth. The outer layer is the enamel, and the inner layer is dentine, which is actually like a marshmallow. And there's a constant flow of fluids from inside the tooth outside. We call it tooth detoxification. In a more layman's term, that is how a tooth poops. That's why when we wake up in the morning, we have this bad breath and we go brush our teeth. So the tooth is constantly undergoing a process of detoxification. It's these fluids which move from inside to outside. So all the acidic bacteria from the tooth moves from inside to outside. However, if we don't have a right balance of the alkaline and the acidic foods, the process of this fluid movement reverses, and now the fluid is moving from outside into the inside, leading to decay, infection, and disease. A very simple way to know this. Now, as you know, that foods that we eat get metabolized and they have to be excreted. In that process, the waste is acidic, which is why we need alkaline food to neutralize the effect of this waste management, which is acidic. That is why a proper balance of acid-alkaline foods. Now, a therapeutic value of alkaline foods is 90 to 100% of alkaline foods. And for acid producing, I would say about 10%. But what does that mean? Acid producing. We want acid only in our gut to aid in the proper digestion. That's it. We have to increase the acid amount in our gut. But rest of the body should be neutral. Because if that ratio is disturbed, that is what leads to disease. So please check, and it's a very good practice when patients come to our office. We highly encourage them also, and we check their saliva. It's something you can do at home. There are salivary pH strips. You can get them once a month, twice a month. You can check it at home. Just spit and put the saliva strip. See where your pH is. If it is not improving, you can see a naturopathic doctor, or you can increase the uptake of alkaline foods. It's a great way to keep yourself in a preventative way at home. So, you're not always running to the doctor when there's a calamity or in a crisis situation. So, supplement. Same thing. These days, we all hear about the quality of the soil, the organic food, and definitely it is compromised in more ways than one. I would not like to get into too much details, but supplementing with right vitamins, minerals, essential fatty acids, probiotics, digestive enzymes, and amino acids play a very, very integral role in maintaining the harmony when it comes to diet and nutrition. If this aspect is paid attention to on a regular basis, your pH will always be above 6.9. And please know, a pH about 6.9 and up to 7.4, it is impossible to get cavities. Impossible. So that is the state we want to be in. We want to keep our body alkaline, 7.4, 6.9 to 7.4. If the pH drops below 6, that is when you're going to start seeing symptoms. So this is something at home that you can monitor much, much easily.
How do you monitor?
Well, the pH strips, you can use them at home. They are salivary strips. Very easy to use. You get them on Amazon. They cost about $8, $10. And you just spit and put the pH strip, and it's got a color scale. And you can see where you are. So body is acidic, maybe you need to increase your alkaline foods. And if you think the condition is not improving, then it has to do something with more internal. And that's where we have our expert, Ray. And they have some really good tests which they use to check for nutritional deficiencies. Micronutrient test, it's a fantastic test, and it shows your vitamin levels, minerals, enzymes. That's a great way to see every year where you are with that, and just the right supplementation will change that balance proactively in the body. What are the other factors that assist in healing? The number one cause of disease in the body is dehydration. So please make sure we are always hydrated. We are in this cold place. We don't feel thirsty enough, but electrolyte intake and hydration will go a long, long way. Sunlight, of course, regular exercise is very, very important. Enough oxygenation in the body will always keep disease away. Restful sleep, nasal breathing or deep breathing exercises. And of course, mindfulness practices, I like doing meditation. It can be taking walks in nature, journaling, whatever your definition of mindfulness, but it is very, very important to be in a state of stillness. That's where healing happens, because body only knows how to heal. So we have to bring ourselves in these states. Now, that's a picture of my daughter and myself on the top of the Edge building in New York. That was our mindfulness practice for that particular day. So you can go hiking or cliff hanging. This is just an example. A lot of people ask me this question: can cavities be reversed? The answer is yes and no. It all depends on where the cavity is located, how tiny it is. If it is on the outer layer of the tooth, yes, cavities can be remineralized and they can be stopped. The diet which helps in preventing cavities is the same which will help in reversing cavities. Okay? So please remember that alkaline acid ratio. You can reverse cavities. But if cavities have extended into the softer layers of the teeth, it is not possible. As I explained, the inner layer of the tooth is more like a marshmallow, and it is more softer, and cavities progress very, very faster in the inner layers. But some of the ways that you can prevent cavity, having good amount of saliva in the mouth, good oral hygiene, very important. Hydroxyapatite toothpaste. What is hydroxyapatite? Enamel is made of hydroxyapatite crystals. So toothpaste which has at least 10% hydroxyapatite will remineralize the enamel and will stop the cavities where they are. Herbal and homeopathic remedies. We use acute homeopathy in our office to treat cavities and many other conditions. And we also carry a lot of herbal products which increase the level of the pH in the mouth, moisturizes the mouth. Some of them have xylitol, which all aids in preventing and treating cavities. Ozone therapy, has anyone heard about that? So it is oxygen therapy. As you know, oxygen is highly essential for healing, right? So we use ozone, which is an extra molecule of oxygen, which is a very potent antibacterial, antiviral, antiparasitical, and antifungal. Once ozone is introduced into the tooth, it completely eliminates the bacteria, and then we restore the teeth either with crowns, fillings, or whatever treatments we do, and the efficiency is increased to 100%. Healing is much, much faster. Patients recover very well. No post-operative sensitivity. And we use ozone extensively from our cleanings to extractions to all surgeries. It's a very, very highly effective treatment in dentistry, especially biologic. And of course, regular visits to a biologic dentist, because they put these principles and protocols into practice, so you know that you're always in the safe zone, you're not exposed to toxins, toxins are taken care of, and you're always in a state of prevention. So these are some of my affiliations. IAOMT, this is the International Academy of Oral Medicine and Toxicology. We are all science and evidence-based dentists who are part of this organization. Everything is research-based. Whatever I have mentioned today, you can go onto this website and read more and length and in detail. And if you're looking for a biologic dentist, this is the place to look for a biologic dentist. Okay, you can enter your zip code and it will locate all the biologic dentists in your area. Holistic Dental Association is another holistic organization I'm a part of. And then Science of Spirituality, as I mentioned, I'm a mentor for children and youth and teaching them meditation and all about holistic wellness. Now, as we have transitioned from conventional dentistry to biologic dentistry, we know and we must remember that within you is the power to rise above any situation or struggle and transform into the brightest, strongest version of you ever. Thank you so much, and thank you for having me here. And if anybody has any questions, I would like to take them. Please feel free to ask me any questions. I think I can hear them.
You'll hear them.
Yes.
Online. I'll just repeat online.
Sure.
Thank you, Dr. Raina.
Thank you.
Any questions for Dr. Raina?
Yeah.
Yeah, go ahead.
I have a question about, so by biological dentistry, you're against implants then?
Metal implants. We don't want anything metallic in the mouth. So we are not against implants. These days we have ceramic implants, which are more compatible. So that's the alternative we use.
So avoid the metal.
Yes.
Just repeat the question. They don't have a second round for you.
The question was, as biologic dentistry, do we not believe in implants? So the answer is no. But the alternative to metal implants is ceramic implants because they are more biocompatible.
Recommendations on the alkaline versus acid. I guess acid is more processed food.
So Alkaline foods means foods which are alkaline, and when I speak about acid, so for example, like apple cider vinegar, ginger, this is very good to increase the acidity inside the gut, which aids in digestion. And a list of alkaline foods, like kale, cauliflower, banana. So just increase the uptake of alkaline foods and make sure your gut is more acidic. So we don't want to eat acid-producing foods. Yeah. Rick, yes, please.
Just want to make a comment about the implants because I knew the question would come, and I had endless discussion with some dentists about it. So there is this official language that says everything is fine, titanium implant is fine, but I have not seen a single patient who did not have serious disturbances in the whole biochemistry after titanium implants were implanted. And we had a client coming to us from Wisconsin. She was actually a wife of a surgeon, a famous cardiologist in Wisconsin. And for a year, it was she had 2 or 3 titanium implants. It was crisis after crisis. Every 2 weeks, she was calling us in a really frazzled state that things are wrong and this and that. And when I mentioned to her implants, she said, no, that's not true. They're perfectly fine. My dentist told me they're inert, everything's fine. It took me 6 months to convince her to reconsider. She removed them. Within the first week or 2, it was not major change, and she even called me, yeah, you were wrong. I'm still the same. About a month later, she said, you are right. My life has changed drastically better in every way. The antibodies that were high before, we hardly heard from her after that. Before, it was crisis every week, calling us, I need this, something's wrong, cannot sleep. So her life drastically improved after removing, about a month after removal of titanium implants. And I have heard countless stories like this personally. Zirconia ceramic implants, there's a company in Switzerland, and I was actually in Costa Rica medical conference where there was a presentation, there were 20 doctors there. And this is a brand new technology that has a carbon fiber inside and zirconia outside, and truly has no reaction with the local tissue. And that has absolutely no galvanic effect that you mentioned. Right. So it's perfectly safe. It's of course best not to have any implants, but titanium implants are not very good. You can also be careful to watch ingredients when you buy something. If you find any kind of supplements or food that has titanium dioxide inside, avoid that. It's highly toxic. Of course, traditional, medicine, traditional approaches, everything is fine. But we have practical evidence that these are not fine, and there is a great advantage to not put a metal in your mouth. Just my personal take and experience.
Yeah, absolutely. That's why we need you, Ray.
Thank you.
Any other questions? I have a few questions that come from online.
Sure.
The first question is, does oil pulling aid in oral health?
Absolutely. We highly, highly recommend oil pulling. It not only aids in keeping the bacteria out, especially coconut oil, something our patients absolutely like is also a natural whitening agent. So we highly recommend oil pulling, and these days you have oil pulling agents which have sesame, which has a very high affinity for bone, sesame oil as per Eastern medicine, and that combined with ozone and coconut oil has great benefits. So yes, the answer is oil pulling is a very, very good practice to have on a daily basis.
The question is, what is oil pulling? He's asking.
What is oil pulling? Yeah, so it is basically a composition of oil like coconut oil, sesame oil, ozone. So it comes in the form of oil. So you just rinse your mouth for like a good 3 minutes. I would at least recommend 3 minutes, and then you just spit it out. Yeah, so rinsing with oils. That's oil pulling.
Any other questions out here? All right, I have a couple more that came from online. What is the process for a ceramic implant compared to a metal implant, and is it reliable?
So process is the same. So let's say if you have a cracked tooth and we want to extract it and place an implant, right? So biologically you extract the tooth, that's very, very important. Biologic extractions means atraumatic way of extraction. So you extract the tooth, the implant placement is exactly the same. It is just the material, and as Ray mentioned, what the advantage is with a ceramic implant. So it is more biocompatible and more safe, but the process is the same. Just a different kind of an implant. Yeah.
Okay, another question. Does sodium bicarbonate combat bacterial growth?
It does, it does. And we do talk about that in our practice also. What it does is it increases the pH in the mouth, and it also helps with sensitivity. So sometimes patients, if post-operative after a procedure, they feel sensitive, we do tell them that rinse with sodium bicarbonate, and that will take the sensitivity away. So it definitely has a therapeutic value.
Yes, Rocky? The question is whitening your teeth an issue?
So, you know, it depends what you're using. Of course, very high concentration of hydrogen peroxide will strip the enamel and will make the tooth very, very sensitive. Something we propose at home, it is a slow process, but it is very effective. 3% hydrogen peroxide is food grade, something you can use every day. Okay, and it'll whiten your teeth gradually over a period of time. Coconut oil is also another whitening agent, but it takes 20 minutes to rinse with coconut oil. So I'm not sure if people want to do that. Some people do, but I think on a safer side, 3% is the maximum. I wouldn't advocate anything over that. Coconut oil. Just plain hydrogen peroxide, 3%. Yeah, you can rinse with that every day. If you have gauze, just clean with that. You can do that every single day. It's very, very safe. And you'll see gradually over a period of like some weeks, teeth will start to whiten. It's a great way to take care of stains at home. It's a biologic way of whitening your teeth. Yes, sure.
Yes, go ahead.
For oils,
The question is, when you're using coconut oil for pulling, do you need
Yeah.
to mix it or can you use it straight?
pure. You can use it straight, or you can use it with sesame oil also, or even olive oil. It's a good carrier oil, yes. Yeah.
Question here.
So I have a question regarding fluoride.
Sure.
I have looked for natural fluoride just in my research, and I came across black walnut as one of the things, and I've been using it to brush my teeth. Is that of any consequence? Are you familiar with that?
Actually, I'm not.
Okay.
So it's something, yeah.
Well,
I have-
anything else? Is there anything else, though, that would be strengthening to the teeth that would be similar in terms of the fluoridization?
Definitely. So, like I mentioned in my slide, hydroxyapatite. That is the key ingredient of a tooth. If you're using a toothpaste which has 10% hydroxyapatite along with maintaining your diet, you will absolutely not have cavities. So you don't even have to look towards fluoride. You know, we are in the modern times. I think we have enough resources. Yeah.
I'm going to ask some follow-ups to that.
Sure.
So is the tooth actually made of fluoride? Do we need fluoride at all? Where did fluoride come from in dentistry?
So in the beginning, you know, there are many places in the world, including in India, where water fluoridation does not exist. And that's where people developed a lot of tooth issues. And fluoride has its place. It's not that fluoride doesn't have its place. But question is, in the modern world, we do not need it because the percentage of fluoride that is needed is so minimal that foods also have it, certain waters also have it, and that's more than enough. Anything in excess will lead to the conditions that we talked about.
A question about the hydroxyapatite
Sure.
toothpaste. Is that over the counter?
They are over the counter as well.
What
Like, for
concentrations?
example, 10%. There's a brand we use, it's called Dr. Jens. It was actually developed by a dentist. It has 10% hydroxyapatite.
And the second question, you position about composites and bonding agents. What's
Yes.
the risk in using bonding agents and composites?
Sorry, I didn't get the second. What is the...
He's so shy. What is the risk of using composites and binding agents?
Bonding.
Bonding
Yeah.
agents.
So there is no risk as such if you do a biocompatibility testing and find out which bonding agent you're compatible with and what kind of composite you're compatible with. Because there are some composites which have BPA. So it's very important, this is where biocompatibility testing comes. Once you do the testing, you have a list of what you're compatible with, and those are the composites we use. So yes, some composites do have toxic.
You are aware that there are some people, and there are all kinds of opinions out there, that the bonding agents are toxic and are dangerous.
Some are, you're absolutely right, and I agree with you. But like I mentioned, the only way to know what you are compatible with, the only way to find out is through testing. There's no other way to know that. Because there are, I think, over 100 type of bonding agents out there.
I'm going to ask one more question online, and then I'll get to the others here. So this question says, my high school-aged daughter has had sensitive front teeth all of her life, especially sensitive to cold things like popsicles. Can anything be done about that sensitivity? Don't eat popsicles, right.
Yes. Well, you know, it's a case by case. I think that's something that needs to be evaluated where the sensitivity is really coming from. It's something that, is there a chip, there is a crack, is she grinding her teeth, any other health-related issues. So there are a lot of factors that one needs to evaluate before a concrete, diagnosis and treatment is presented.
I want to make a comment about fluoride.
Sure, yeah.
So
Yes.
I just pulled out one study here because very often, traditional community is telling us that we don't have science behind, but really the science is showing that. Grand Rapids, Michigan is the first city in the United States that got fluoridation in 1945. I just pulled a study from the National Library of Medicine. This is British Medical Journal. The title is Community Water Fluoridation, Bone Mineral Density, and Fractures, Prospective Study of Effects in Older Women. So Grand Rapids, Michigan was the first city to get fluoridated water, and they immediately jumped to the highest hip fracture in the whole country. And then several years ago, based on data and studies, the whole Europe banned fluoride in the water. Only United Kingdom still remained, but the whole Europe banned fluoride in the water. Did not know what they were thinking. In Turkey, there was one village that naturally has high fluoride in the water, and the people there looked extremely old. People who were in 30s and 40s looked like they're 70s, and they have the highest fracture in the world, just for naturally high fluoridation in the water. So fluoride is an incredible toxin. And one more thing that Raina didn't mention, there are so-called halogen elements. And if you remember your chemistry from many years back, chlorine, bromine, fluorine, right?
Right.
Those are all, and iodine, those are all halogen elements, but they're all strong and pull iodine out. When you have too much fluorine in the water, we have bromide all over us. Chlorine we have in the water when you take a shower. You're pushing the iodine out. Women need iodine for three things: for breast tissues, for ovaries, and for the thyroid. Men need only for the thyroid. And that's why we have an incredible larger number of women with thyroid issues. Down. Okay, I see. So women have tremendously higher rate of thyroid issues because the fluoride, bromides, and chlorine pull iodine out, and fluorine and fluoride are present in the toothpaste every single day, and we're not even thinking about it. So if you need sources, Angela can email you a source of hydroxyapatite toothpaste we use, and we both notice the difference. So we would say fluoride out of the toothpaste and add hydroxyapatite in the toothpaste. But studies are solid that fluoride should be out.
I'll just share one of the brands that I've been using in the kids as well is called Rise Well.
Yeah.
And I just buy it online. Rise Well.
The special toothpaste.
Oh, I see.
Yeah, Lysol.
So are you talking about the type of toothpaste? So hydroxyapatite. Yep, and if you need me to send you a message, I definitely will. Rise Well is easier to remember. There absolutely are, yeah. I haven't seen hydroxyapatite toothpaste in Whole Foods, but in some of these smaller natural food stores, you might be able to find them.
Yeah.
But yeah, all of this stuff is available to you. It doesn't require a dentist or a doctor to acquire these toothpastes. Just having knowledge of what to look for.
Sure.
Anybody else? Yes, Rocky.
I was just wondering about the fluoride. They gave a seminar and told me how bad the water was. So we've been drinking, water purified, not purified, but spring water. And so is enough fluoride? I mean, do we need fluoride at all?
So the question comes down to, do we need fluoride at all?
No.
No. Yes? Does filtering take out the fluoridation? It depends on the kind of filter. There's various filters. Yeah, only reverse osmosis, so RO. Some of the other filters are literally only in place to filter out the taste and the smell, and they don't necessarily filter out chemicals or metals. Charcoal does not. No, that's more of a smell, I think. Smell and taste. So reverse osmosis, RO filter to get fluoride out of the water. Yes?
I would like to know if you are recommending to pull out teeth that had a root canal done.
Recommend to pull out teeth that have root canals?
Yes.
As I mentioned, it is not recommended to have dead teeth in the mouth because I showed you a case. So the answer is yes. But let's say if you have presented to me, no health issues, tooth is fine, I like to keep it under observation. Yeah, I don't like to be too aggressive about pulling teeth. But if you are showing some health issues, and if we see in our CAT scans that there is something brewing, then we definitely advise that they should be taken out for health reasons. Yeah.
Anybody else? Going once, going twice. Here, I'll ask a question.
Sure.
Can you discuss the relationship between oral bacteria and gut bacteria?
Oh, definitely. I think that is what this whole presentation is about. And, microbiome, the word that we use very, very extensively, we need the good bacteria and we want to eliminate the bad bacteria. So the way to do that is bringing in the good bacteria so that the bad bacteria doesn't get a chance to do what it needs to do. Now, this is a very open channel. Whatever we ingest will eventually get metabolized in the gut. The metabolism of the teeth and that of the gut is very directly proportional. So that is, I think, the basic core foundation of our health. So again, it takes me back to the same thing, eating the right balance of acid alkaline foods and maintaining that microbiome. If it is not maintained, we call it the perfect storm. And that is what leads to all the diseases. And I'm sure Ray, being the expert naturopath, I think I would like him to say something more on this.
So, thank you. There is a microbiologist, Lyubov Sichel. She is probably the most famous microbiologist in the world when it comes to probiotics. When there was a Chernobyl accident or spill out of a nuclear facility, she was the one who helped a lot of people by developing very unique probiotics. About 5 years ago, she developed a very novel probiotic that actually works just on oral health. It's called ENT. There is adult ENT, there is a children ENT, Lyubov Sichel. So this probiotic works on ear, nose, and throat. And it's very important, first of all, she mentioned the food you're eating, to eat proper food. After your meal, it's better not to brush your teeth right away. For about 15 to 30 minutes, let the natural fermentation happen. But within 30 minutes, you should brush your teeth. And if you can locate this, we can help you, children ENT and adult ENT. It's good to have daily at least one lozenge. It's kind of a dissolvable lozenge of these probiotics developed by these famous microbiologists to keep your microbiome intact. That's my suggestion.
And that's something we dispense to our
Yeah.
patients at the office, this supplement.
Yeah, you can get
Yes.
for her office
Yeah.
as well, yes.
There's some more questions online. Should wisdom teeth be pulled out?
Answer is no. We don't want any teeth pulled out unless it's absolutely necessary. So these days, 99% of the wisdom teeth get pulled out because the way they are located in the body, in the mouth. You know, either they are impacted, they are not erupted. So if it becomes a source of bacteria, then that needs to be evaluated really, really well. And if that is the case, the answer is yes, but otherwise we don't believe in pulling out wisdom teeth unnecessarily.
Thank you. Is it better to brush your teeth in the morning before or after you eat breakfast?
Good question. I brush my teeth after breakfast. And as Ray mentioned, you have to wait up 20 to 30 minutes. And I think, Ray, there's a more layman's way of explaining that is when you eat, all the bacteria comes around, right? You've just eaten. And they start releasing acid. So that is releasing acid. So you have to wait for them to release the acid. It takes them about 20 minutes to do that. Let them release their acid, let them have their party, and then you let them go away, and then you take the brush and clean. Otherwise, you're actually spreading the acid everywhere. So you have to wait 20, 30 minutes after eating and then brush your teeth.
And how often should you brush your teeth every day?
Well, I brush morning and night. So definitely before sleeping, please know you're sleeping for 8 hours. It takes bacteria only 20 minutes to start a cavity. So if you go to bed with food stuck in between your teeth, so 8 hours is a long time to start cavities.
I have a question. If a patient has an infected tooth that needs root canal, should they get the root canal or extract the teeth?
So that's a great question, actually, because in our office, we avoid root canals. And almost, I would say, 85% of our cases, we turn teeth around from root canals by using regenerative materials. So I think I'll have to really see the X-ray and decide. But if it is at a point that it's an absolute root canal, the infection has spread to the bone, the answer is that it is better to extract the tooth.
Okay, thanks. Yeah. Another question, I just heard a comment that anybody who do have the implants, they have serious complications. My mind cannot handle this because I know a number of people who do have implants and they don't have complications.
Ray, I think I'll let you
all.
answer that.
When you do the comprehensive chemistry the way we do, and you look at all the antibodies, I cannot make a statement, you know, general bombastic statement, but I have not seen case that did not have elevated antibodies, personally. So we see, even if there are no symptoms, you have to understand the symptoms is just the tip of the iceberg. You do not know what is behind. Years ago, I had 2 young people that came to me. One was 30 years old, one was 32. They heard about me and asked, what's your problem? I said, nothing, I'm healthy. Both of them said the same thing. When we did analysis, there was a tons of issue. Because when you do proper functional medicine, you see the disease in progression before it has any symptoms, 5 or 10 years earlier. Both of them happened to have serious cardiovascular issue that they did not have any symptoms of. The first sign of cardiovascular disease is death. There are usually people that have no chance to respond. So if you do proper deep analysis, you would find issues. Now, it's possible that somebody has, you know, a titanium implant and has no symptoms, but I'm not saying that every case I'm guarantee you there is nothing going on, but I would like to evaluate that case and see in the blood chemistry, the way we do it is really, truly nothing going on. That's my experience.
Yes.
So if you have somebody that has these implants, potentially titanium ones, would they go to a holistic dentist first, or would they go to a naturopath?
Yes.
So
And
holistic
I'll-
dentist is
And
the
then I'll
answer.
send them to Ray, of course.
I think I saw a question back here.
You know, we have been using Sensodyne, but I've noticed that my husband's gums have been receding. So I didn't know if it was a toothpaste, but they told him that he had to get him reconstruction. I don't really know the
Grafting,
term.
gum grafting.
Yes, that he had to get him before he, like, the roots of his teeth start showing, and that they just, I mean, he might just lose his teeth. I mean, what do you think about that?
Yeah, that is correct. I mean, that depends on the degree of the recession of the gums. I mean, if the root is that exposed, and is it front teeth? The
Yes,
lower?
the lower teeth.
Yeah, they are the thinnest teeth in the mouth. And if they have a lot of recession, for them to fall out is much easier. So definitely gum grafting is highly recommended, and it is better to be done by a biologic periodontist because they use ozone therapy, and that really elongates the lifespan of the treatment that is done.
So is it safe?
It's safe, yes,
safe?
yes, it is.
The other thing that dentists mention is that we really like a lot of smoothies, and he says that it could be the acid from the fruit. Is it true?
What kind of smoothies do you drink?
We like, I don't know, pineapple, mangoes, oranges. I mean, we mix greens. I mean, different kinds of fruit.
Oh,
He says that
I've
it's
not heard
because
of
we
that,
have a lot
Ray.
of acidity.
I mean, she's saying that we drink a lot of smoothies. So is it the acid from?
I'm strongly against that. That's not what
Yeah.
just a real
Hang on, Ray,
Correct.
hang on. Let me bring back the mic. We need one for you.
First of all, let's agree that we can disagree and still be friends. During COVID, I had a sermon here, and, we had certain division, but I was glad that both sides came to me and thanked me for my sermon. I think there's a way to agree to disagree on certain things. And smoothie is not the worst thing in the world, if it's healthy, but, it depends on the level of, strictness you want to have for your own health. So our kids have smoothies sometimes. I'm against it, but it's hard to fight. So we are meant, when I talk to clients, I tell them, eat food that is the closest the way it appears in nature. Apple grows on trees, apple pie doesn't. Don't eat apple pie. Eat apples, right? And eat the food that existed before modern times. 500 years ago, was there a smoothie? No, right? So the best is to eat from the source as it is. Smoothie usually have to add often dairy products inside. If it's just kind of a broken fruit, that's fine. But what you're missing there, you need to masticate. If you don't masticate the food, saliva doesn't respond. And our system has a trigger mechanism. So when you masticate, saliva gets released. You send a signal to the parietal cells in the stomach what to release. But when you take a smoothie, that's missing. So we cannot outdo God. He gave us teeth, he gave us fruit to chew, to experience every flavor separately, not all combined, And again, it's not the worst thing. A lot of smoothies are fine, but I really don't think that's the way how we should ingest our food. I think real fruit and just chew it thoroughly.
So, Ray, she asked a question that
Yeah.
is it the acid from the smoothie that is leading to recession?
First, can you
I have
clarify?
not seen that.
Can you clarify the smoothies that you are using? Do they have any dairy? No, just fruit. Yeah. If it's just fruit, no ice added, right? Just fruit alone. So there is not necessarily acidity. That's fine. If you mix fresh fruit, you just do it. It's not going to be acidic. The only problem is saliva connection. So if you really still prefer it that way, one doctor said at the seminar, chew your liquids. Then put the smoothie and keep in your mouth for a long time. Do not just kind of gulp it, right? And then you're close to perfect, meaning close to eating real fruit. But it's not going to be acidic if it's just fruit. That will be fine.
See, I get to learn a lot too. That's why I love working with naturopaths.
Oh, more questions back here.
After several years of titanium implant, can you take it off and reverse it after 6-7 years? And
Yes, They can always be taken out and replaced by ceramic. Just the process is a little time consuming, and I think that's a question many patients ask.
Yeah, my question is because I understand that after a period of time, it gets sold with the bones.
Correct.
And how is it going to be taken off and replaced? That I think that's...
Well, you know,
I
surgeons who
cannot imagine
place
that.
implant, they know how to do that. It is easier for them. It can be taken out. The answer is yes. They can be taken out, and they do that quite often.
Is a biologist, dentist supported by any kind of insurance or something like that?
Yes. See, you know, we are of course using fillings, we are using implants. It's part of dentistry. So most of it as based on your insurance, what they cover for preventative, major work. So they do cover. Many of the ceramic implants are also covered, like up to 50%, Bhavya, would you say that? 50%, they do cover that. It's smaller procedures like ozone therapy, you know, they don't cover that, but it's not too expensive. It's just an add-on. But most of the dentistry is covered by insurance.
Anybody else? Well, thank you so much. This was a great dialogue. I want to say, on your way out at the table back there, if you will fill out your name and email, I guess there's a raffle. We're raffling off a cookbook. And we will have refreshments, so please do join us. I believe we're going to be in the fellowship hall, so we can continue to dialogue. Yeah. Dr. Raina, thank you. This was wonderful.
Thank you so much. Thank you so much. It was lovely being here. Thank you. Thank you,
We would
Jella.
love to have you again.
Oh, thank you. You know, I was telling Jella that each topic of biologic dentistry is a topic in itself. And even I was preparing, I was like, oh God, I need to add this, I need to add that. And, you know, and each presentation actually will answer a lot of these questions that you have asked. But I think it's a great place to start and get exposed to this concept. And once this door opens, there is no turning back. It's a beautiful, beautiful world of dentistry. And I think I tell everyone, and I'm sure Angela will agree with me, it definitely takes that anxiety out, which patients feel a lot with dentists. So it's a great way to do dentistry for me as a dentist, and I love to see my patients very relaxed, calm, with all these, you know, natural methods that are available these days. So I'm so happy and I'm grateful that I'm part of this journey in today's times, and it brings great joy to share it with you all. So thank you so much.
Thank you, everybody.
Thank you.
I think we have a slide for our next health event. Yes. So just one more announcement before you are released to join us for refreshments. We will be having, the 12th International Vegetarian Food Fest here at the Elmhurst Seventh-day Adventist Fellowship Hall. And this will take place on Sunday, June 4th. From 3:30 until 7 p.m. So please do join us. This is always a fun event. Bring your friends, and we'll have awesome food and awesome time together. So we'll hope to see you on Sunday, June 4th. And thank you very much. That wraps up our presentation.